Let's begin here. South African health experts say primary healthcare doctors need to act immediately upon suspicion that patients may have cholera. The National Department of Health, together with the National Institute for Communicable Diseases, have given an update on the cholera outbreak. At least 15 people have already died of the disease in Hammanskraal, north of Pretoria. Experts say residents in informal settlements that have little to no access to clean water are most at risk of contracting cholera. Some of the symptoms include vomiting, diarrhea and severe dehydration. As testing continues at the country's laboratories, the NICD says the infection rate is probably much higher than is currently being recorded. People are advised to boil water before drinking it and to avoid using water that could be contaminated.
Well, tonight, investigations continue into the source of the cholera outbreak in Hammanskraal, Tshwane. Over 100 confirmed cases and 15 fatalities and counting. The Department of Water and Sanitation says the water quality challenges are in central Hammanskraal, which is supplied by the city. But while government makes even more commitments to residents to rehabilitate and upgrade the Rooiwal wastewater treatment works, and a task team assembles to oversee the turnaround, families and residents are wondering whether this time real action resulting in safe drinking water from their taps will finally come. Over the years, protests and promises have been the central themes of water supply there, this time taking a deadly turn. Well, let's find out the latest on the health front with Phuti Sekwadi, who's a field epidemiologist with the National Institute for Communicable Diseases. Good evening to you, Phuti, and welcome. In the earlier piece, you would have heard a message from the NICD, treat, don't wait. And that's the message that you're sending across the country to clinicians, primary healthcare clinic, to begin the treatment even before you get a diagnosis. And I'd like for you to just reiterate that message and why.
Good evening to you, and good evening to you, the viewers at home. Yes, indeed, that is the message that I would also reiterate. The key to managing cholera properly is to administer treatment on time. For patient to get treatment on time, that is very key in those patients recovering, because with cholera, it can result in death very quickly if it is not detected fast and treated appropriately. So it is important indeed that when, especially in the current circumstances that we are in, and especially for the people in the areas of Hammanskraal and the nearby areas as well, if people are presenting with symptoms typical of cholera, which normally is your very watery diarrhea and vomiting sometimes, they should be treated immediately, even before there could be a laboratory confirmation. And also, those cases should be notified to the National Department of Health and the provincial departments of health and so forth through the normal notification system, so that the outbreak response teams may be able to respond rapidly, to those cases as they present to health facilities.
Phuti, you talked about the quick treatment being the key to a potentially good turnaround. If you can't get to a clinic quickly enough, is there anything that residents and those who might be affected, is there anything they can do at home?
Yes, definitely. The treatment for cholera is not a complicated one. Even at the hospital, they will still give you the oral rehydration solution, which people can be able to make, and they can prepare at home. It's basically a mixture of salt and sugar, but it's important that safe water is used for that solution. So if people can get to the healthcare facility quick enough, they should prepare the oral rehydration solution at home and take that in the meantime as they are making plans to get to the healthcare facility. And with cholera, not all the people will have severe form of the disease. So some will have mild symptoms, which might not necessarily require them to go to a healthcare facility. So those can be treated at home by simply taking the oral rehydration solution. Even if you are looking after children who are having symptoms of cholera and vomiting, or symptoms of diarrhea and vomiting, it is important to give them the oral rehydration solution.
Yeah. Phuti, this oral rehydration solution is actually quite simple. It's a very small quantity of sugar and salt. Just quickly share that recipe with our viewers, and I've got 1 or 2 more questions for you before I let you go.
Absolutely. It's 6 teaspoons of sugar and half a teaspoon of salt, and those you put in a liter of safe water. Just make sure the water is safe. Either you can boil the water before and then you can prepare the solution like that. 6 teaspoons of sugar and half a teaspoon of salt.
But I just want to go back now to the other big question of the night, and in a moment we'll be speaking to someone from operations in terms of actually the provision of water. But what more do we know about how these residents got cholera?
Well, at the moment, investigations are still ongoing, but looking at the number of people that are affected in the area, particularly the Hammanskraal area, we cannot say for sure that the source is water, but usually when there's huge outbreaks of cholera, similar to what we are seeing now, most of the time the contamination would be coming from, it would be something to do with the water that people are consuming. Because from the preliminary investigations that have been done, there's nothing really that connects these people that have presented to the healthcare facilities. They have not attended common events or eaten something common at a specific place. So the only thing that really links them together is the water that they have access to in their homes. So there are still tests that are being done on the water. We cannot rule out the water yet, but usually with big outbreaks of cholera, you may find that the water supply may be where the issues is.
Okay, that's an important note upon which to end. Phuti Sekwadi, thank you for talking to us. Phuti is from the NICD. We'll have that recipe up for you, hopefully, on how you can hydrate at home. Very, very important. He said it's simple. You can do it in your home. 6 tablespoons of sugar, half a teaspoon of salt, and 1 liter of safe drinking water.